This is the Canadian Dentist Podcast with Dr. Carlo Biasucci.
Welcome, everyone. Thanks for joining us for another episode of the Canadian Dentist Podcast. I have joining me today from RNA 180, Janice Whalen, who is the founder, and Angela Harley, who is the Chief Operations Officer. Ladies, welcome. It's good to have you.
Morning, Carlo. Nice to be here.
So the first question our listeners are going to ask is, what is RNA 180 and why should I care? Now, just quickly before I turn it over to you guys, I cross paths with this platform through mutual clients. So some folks in the Elite Practice Transformation Program were using the RNA platform, and I asked, what is this? What are you doing with it? Does it work? And I was super intrigued by it. We started talking, and I think it's something that every dentist should hear about. Certainly, if I could go back in time in my own practice, this is something I absolutely would be using. So let's maybe explain, what is RNA 180? What is the concept? How does it work?
Angela? RNA 180 is a software that works with your dental practice software to pull data, which will be able to help with production, maximizing production and elevating patient care. So when we speak about production, we only speak to the dentist in regards to that. Hygienists do not want to discuss dollars. So we really focus on the do but missed. What procedures are they missing? And from that, we're able to increase production.
Okay. So what I've found in talking with clients and also in a couple of sessions that we've had is that the platform really does a couple of things very well. The first is that it helps you to look at your hygiene day and say, okay, if you're like me, where I've got one hygienist who bills really well and one who bills really low, and the rest are kind of in the middle, and I go to my hygiene team and I say, okay, why can't you do what she does? And one will say that one's overbilling, and the other one will say, well, they don't bill what they're supposed to. And then you have this crosstalk, and it goes nowhere, and it's completely useless because you have no data. And so the way to approach it is, well, what's the data? And so this is why I'm intrigued with the platform, because if I look at it, it's an objective look at the way that your hygiene department runs a day. So if their patient is coming in and they're actually due for, say, 3 things or 4 things, call it 4 things, how do I know that I actually did what they were supposed to do? And how do I know that this patient is not just coming in, getting something done and leaving, and we're booking the same amount of time every appointment and not actually capturing the things that could have been done? So it helps me to plan my appointments. It also helps me to manage or budget my time so that I'm booking the amount of time I need to do the things I need to do. Basically, what it does, as I understand it, and you can correct me if I'm wrong in a moment, is it helps me to look at, if I'm booking an hour for a patient, is that even the right amount of time? And if it is, am I getting all the things that the patient is due for done in that time? And if I start looking at the data and paying attention to it, then I'm capturing, as you said, the do but miss items, which by just doing what is standard of care and what the patient needs, my billing automatically goes up. Is that a fair?
That is 100% correct. And you are right when you say there has never been any data. So from my days when I was in the dental practice managing, I did all of the dollars per hour. But beyond that, unless I went into every single patient chart, did they get everything done that they were due for? And not only that, I also thought there had to be a better way with determining how long an appointment should be. Why should we just arbitrarily book 60-minute appointments for every single patient? Why don't we book the amount of time that they require for each of the procedures? So when speaking to some of the hygienists I worked with, they were never unhappy with having too much time, but they were always unhappy when they had about 90 minutes of work, but they had to fit it into a 60-minute time frame. And rightfully so. They're going to have to start cutting procedures so they can fit it all in the 60 minutes. So with the software, they can actually go in and plan their next appointment, and the system will tell them how much time they would need to book and when they should book it. So they're not booking 2 days before the patient's due and missing out on that because they have no coverage. If the system says that they need 80 minutes, book 80 minutes. And at the flip side of it, if they need 40 minutes, book 40 minutes. So allocate your time based on the patient needs to ensure that each patient gets everything that they require.
And just jumping in, the one factor that we may have jumped through is how we develop those timeframes.
Mhm.
So we have a DNA and an RNA. The DNA of the practice is individualized to every single clinic. Whatever codes you use within the scope of a hygiene chair is what we're actually putting through as a DNA. Then we give it a default time frame and a default interval. We pull the information from your dental management software and push it back to the hygienist. That's where the RNA comes into play, where the RNA, the name of the company, is the messenger between the DNA that you've built for your practice, the hygienist, and what's required for the patient. So we're not force feeding what we think is a requirement for each of your patients. This is built the way you work from an owner's perspective, as well as from a hygienist's perspective.
Okay, so if I can break that down, if I am the owner of the practice and I sit down with my hygiene team and we say, okay, here's what we agree to as sort of a standard operating procedure according to standard of care, and we say that, for this, we're going to take this much time, or these are the things that we want to include, and then that becomes what the software then uses as its base.
Exactly.
Okay, because one of the myths that people might get hung up on is that this is all about like maximizing production. That happens as a byproduct, right?
Absolutely. Absolutely. The other factor is, I know we have mentioned billing a couple of times. We've actually changed the wording of that from billing to coding. We're not really that interested in billing. As you said, it's a byproduct of coding the information correctly. For example, a scaling unit, because that's such a subjective code or a subjective service, everyone has a different idea of what a scaling unit is. And no two seems to be alike. It seems to be like a fingerprint. So we've been able to harness all of that information and say, this is actually the building of a scaling unit. So these are all of the components and how this actually is built. That is something that was put together as a joint statement from the ODA and the CDHO. Now, unfortunately, we've had to go back to the original joint statement because there's only one joint statement from 2011. In 23, the ODA came out with another statement that clarified things a little bit better following COVID so that we fell in line with the requirements of COVID, et cetera. But that was never brought out as a joint statement with the ODA and the CDHO. So we go back to joint statement of 2011 and we provide all of our clinics with that magazine because it came out in Milestones magazine in 2011. So you can imagine the number of hygienists that have either left the profession that were pre-11 and the ones that have come in from post-11. Those people have never seen that joint statement and they don't know what it is. Unfortunately, after, a conversation with many of the school systems that are teaching hygiene, as well as the CDHO, they don't teach to a scaling unit because it's not part of their mandate. What they're taught in schools is please write down the number of minutes that you scale a patient, the number of minutes that you polish a patient. That's it, full stop. Nothing else is required. But when you look at a scaling unit and the fact that it's reviewing the patient chart before they arrive, reviewing the medical history with the patient and gaining consent, post-op instruction, writing up of the chart, anesthetic, the list goes on. but it's not captured. So when we're talking about, you're saying billing, we're saying coding. And by coding, we're saying if there's a minute here and 2 minutes there, and I know that sounds very much like minutia, but when we look at those components, we can arbitrarily miss 12 minutes on every single appointment. So, and again, 12 minutes, very, very particular. But if you're going to be particular with everything else in an appointment, then I think the coding of that appointment is also it should be particular. Very long-winded, my apologies.
No, that's good. That adds a lot of clarity. And so if I'm coding appropriately, then on average, the typical practice, just doing the math, should capture somewhere around $30 per appointment, let's say.
Absolutely.
Yeah, it's about $30 to $50 extra per hour. And as Janice was saying, all the elements of a scaling unit, when you look at a hygienist having to fit in the adding up of how many minutes did I use to review the patient chart before, how many minutes to review the patient history, gain consent, there's a lot of math that a hygienist has to do, and in a very limited amount of time. So by having a tool, a software that actually does it for them, they don't have to think about it. They don't have to think about adding up all the minutes, figuring out it's 38 minutes. Well, is 38 minutes a unit and 2.5 units? Is it 3 units? They don't have to do that. It takes the guesswork out of it so that doctors realize the production that has been done, as opposed to just spitballing it and saying, well, it's about this, so this is what I'm going to code.
Okay, good. That's very interesting. So I want to back up for just 1 sec. So you had mentioned so for Ontario dentists, the CDHO statement is definitely applicable. People listening to this will be across the country. If I'm in Alberta, is there a similar sort of thing that we can fall back on?
It's a yes no answer, to be honest. Alberta does have more that is part of a scaling unit than we do in Ontario. If I'm not mistaken, they also add probe scores into theirs. We wish that we did, but we also have a way of mitigating that as well. So we work to the bottom of the scaling unit, if that makes sense, so that we can mitigate the 7 minutes between the bottom and the top. So we can't code for probing in Ontario, but we can mitigate the time and use it effectively within a scaling unit.
Okay, so wherever you are, understanding the coding is really the key. And if you're coding appropriately, then you're staying on side, you're at standard of care, but you're actually billing for what you're doing, which I think is that gap, because I don't think there's a dentist out there who, maybe I'm wrong, but at least in those who I talk to, I don't think there's anyone out there who thinks, my hygienists are underbilling. Like they should be billing less. And there's always this sense of like, we're spending more time than we're getting paid for. Like we have to do probing, we have to do these things, we have to educate the patient, but we can't bill for this because insurance doesn't cover it. All of these kind of issues come up. And so it feels like there's an appointment that's had, and maybe like 2/3 of the appointment we got paid for, and the rest of it was just dead time. And so as I'm understanding that if it's coded appropriately, there's not so much dead time or unbilled time. There's actually, you are able to capture, as I'm understanding, $30 to $50 per hour per hygienist. So I'm just doing the math really quickly in my head, but in the average practice, that's got to be $100,000 or more.
That's exactly what we work to, is $100,000 a chair. The interesting part of that is, part of it is a coding issue with respect to scaling it, but the other part of it is also the do but missed. So when hygienists are reviewing their charts in the morning and they're looking at what their schedule actually looks like, they unfortunately have to make some choices. Do I do the full Monty and then run the risk of being behind for my next patient and making someone angry? Do I cut out a couple of services that I think, well, I'll do it at the next appointment? Those types of things, you need to make those judgment calls on the fly. But unfortunately, those are judgment calls that are being made by the hygienist, not necessarily the dentist. So one of the factors that I talk to literally all of my clientele about is that there really are no such thing as emergency patients. And I know everybody has them in their schedule, but the reality is the only time you should ever see an emerge is they've been in a motor vehicle accident, they've been in some sort of sporting accident. The rest of the time, it is nothing more than I never got the diagnostics to actually be able to inform my patient that that treatment was required. So if we don't do those diagnostic procedures and give the doctor the ability to have the conversation, then yes, you're going to end up with emerges in your day on a consistent basis. So if we can give the hygienist a better time frame and what that looks like, that could be 40 to 50 minutes for a scale only appointment. It could be 80 minutes for a full out recall appointment where you've got, x-rays, recall, scale, polished fluoride, whatever the case may be. But if we build the time better, then we treat the patients better and we allow the doctors to be able to diagnose better.
And the key words here is you don't know what you don't know. Like we've gone into practices and put our agent on and did an initial assessment and had clinics that the dentist was blown away that pans were missed 80% of the time. That's not data that we've ever had before in the industry, what was actually missed. So they can actually look at that immediately and make changes to how they do things so that they can better improve. And although we are primarily a hygiene software, I mean, we've gone into clinics where the owner can't figure out why his day is not fully booked. And when we've gone in, well, it's because 86% of the recall exams are being missed, which he didn't know. So by giving the information and sharing that information, then you can make decisions on how you want to manage it.
So one of the really cool things that you showed me was, because my practice was an assignment practice. Every practice in the market that I'm in is an assignment practice, and insurance is a thing. Everyone is going to question, well, if my appointment was this much this time, why is it more next time? Why today is my appointment $200, but my wife who came with me is $250? Like, where's the gap? And so you have this objectivity now where you can actually show them directly. The platform can print off, here's exactly what got done. Here's what you had done, here's what she had done. And you can see the list of services. And so it helps them to understand and makes the problem go away so that we're not trying to backpedal and explain, or worse, write it off just to make them happy. So having the data is super important. The other cool thing that you showed me was sort of the breakdown of the graph of the do but missed. If you take a typical practice, you install the platform, and you now can have all of this data on, here's my patient base, here's the last X weeks, months, years of appointments in hygiene, for example, and what's the trend? So as you said, if I've been missing pans that the patient should have had, or recall exams the patient should have had for any amount of time, first of all, it's lost hygiene revenue, but then it's also lost doctor revenue. And so this snapshot gives you a ton of information. And this is something that you can do for any practice, right? As a maybe just talk for a minute about if a practice wants to, if a dentist wants to see, well, if I want a health check or an audit on my practice, my patient base, my hygiene base especially, can I do that? How does that look?
It's actually it's very simple. They can just reach out to us. We will touch base with their IT to install a agent on their server. Typically that takes maybe about 10-15 minutes, and pretty much the same day we will have access to their information and be able to assess it and give them an assessment.
And the assessment includes basically the information they need to understand. Here's where I am. Here's where I should be according to standard of care, proper coding.
Right, exactly. It goes through all their, the typical dollars per hour for each hygienist, their due but missed, how much possible revenue they're missing from the missed procedures. We also can go through and we can tell if how their PMS is also set up and if there could be some issues with that as well. So quite often, well, maybe not quite often, every once in a while we've run into a clinic that has been reusing their provider codes. So the information's kind of all over the map. So we can actually help them as well, not only with driving their production, but also making sure that their PMS is also set up correctly to give them the correct information.
Okay, so it's a pretty straightforward process. If
One of the things that would probably be very interesting to the people listening to your podcast is none of us really know what a per hour is for each of our hygiene team because it seems to be an elusive number that is all over the place. Everybody's got a number, but it really doesn't have any statistical background.
Mhm.
Just to give you sort of a broad brush of what that looks like in Ontario. After we finished with COVID in 22, fallow times was done, and now we're going back to working like regular. Um, we then took those time frames from August of 22 to December, and all of the aggregate of the hygienists that we had at that time, which was about 200 or so, and said, okay, what is your all in per hour? So at that point, they were at $267 an hour. We added the 23 increase of 8.8%. They were at 292, 24 at 302, and now in 25, we're looking at 308. We are the only software that can take an all-in number. And by all in, I'm saying whatever is actually happening in a hygiene chair, from recall diagnostics to preventative itself. We also, though, do look and do add in steri time, anything that happens in the chair. Things don't necessarily need to be billable, but they do need to be attributed to those appointments so that we can build better appointments for hygienists. So 308 is the 2025 number in Ontario.
Okay, that's a really good point. So in that $308 per hour, which is a great number to be at, I would guess that 99% of the people that hear this aren't there. The goal of the software is not to bill for every second, it's to account for every second or every minute, let's say, so
That's
that
right.
the hygienist is not going to be in this position. Because one of my questions is, well, what about pushback, right? But the whole idea is we're not trying to get $1 for every minute that I spend with the patient. I'm just trying to build an appointment so that I don't run behind, but I get done what needs to get done, and I bill according to standard of care.
Absolutely. Absolutely. So, steri can be very different from one clinic to the next. So obviously, it's not a billable service, but some have steri techs. We're just doing nothing more than turning over a knob. It's a 2-minute affair.
Mhm.
Other clinics, different story. We don't have anybody. So, maybe my first appointment is 2 minutes, and by the time I get to my third, I need 5 because I need to process my last 3 sets of instruments.
Yeah.
You can build that into your day to develop a better day where you're not constantly behind.
We can also take the data as well. So if a dentist is wondering if they should possibly hire a steri tech, we can actually help them with getting that information on how much time is, quote, lost on the hygienist doing the steri. And would it be better for them to hire a steri tech so that they're actually seeing more patients? And we can kind of determine that, help them get to that point where they can make a informed decision as opposed to just kind of guessing, well, maybe I should get one, maybe not. We can help them.
Yeah, that's a really good point. So again, if you want to make a decision and you don't have the data, you're just guessing. People often come to me with that question. How do I know when is the right time to hire X, Y, or Z position? And it's always data that you need.
Yep. And we've got the same thing with, iTeros, Velscopes,
Mhm.
EMSs, woodpeckers, all of those things. We want hygienists to use those pieces of equipment, and we assume that they're being used until we add it into our do but mist and find out, 95% of the time, this piece of equipment sits doing nothing but collecting dust. What do we do with that? And again, those types of things are not billable services, but they are something that is beneficial to the patient. We need to take the time to do it. And in order to get someone to do what you want them to do, you have to give them the time. So it's beneficial in the end to the office.
Yeah, I want to spend a minute on that, Janice. That's a really good point. So if I have an iTero or I have two iTeros, and as we teach our clients, it's okay. Well, if you use the thing and you do a simulation and you show the patient, hey, here's where you are. Just if you're curious, here's what we could do if we did Invisalign as an example. It could be anything. But if you are using it, then you will get results. If you have it, but we never have time, well, then it's dying in the corner. Now you're not billing for it, but you're coding for it so that the hygienist has time and you're tracking that they did it or didn't do it. And that's just that little bit of accountability is so important. And now I can say from experience, I've seen some of our clients who are on the platform, the RNA 180 platform, that they are getting this movement. And it's not just about hygiene billing, it's about building a better clinical team so that the end product for the patient is better. And yeah, of course, the billing goes up. It's just, it's impossible that it wouldn't. You're just doing a better job.
Absolutely. Patient care.
Yeah. Yeah. I mean, and again, I can say, that you stated $100,000 per chair, just anecdotally without putting data up on the screen, more out of confidence than anything. But the clients that we have on the platform, when I look at their numbers, in the RNA 180 platform, you're there. And the bigger the clinic, the more substantial the number. So I wish that we had this platform and I can go back to my practice, which I've now sold. But with 7 full-time hygienists, I can just imagine, what could have been gained there. But regardless, yeah, the best time, as they say, the best time to plant a tree was 20 years ago. The second best time is today. So for those who are curious, where do they go to find out what does my practice look like? And is there a cost for this, for the initial look, for the ongoing kind of, what does that look like for somebody who says, okay, I hear what you're saying. This sounds interesting. I want to know more. What's the next step?
Yeah, you can go to our website at www.rna180.ca. Because we have a relationship with Elite, we have waived all of our initial fee structure, which for anyone that's interested to know, that is customarily $3,000. So our connection with Elite has dropped that. We can put agents on a server with AbleDent, Dentrix, ClearDent, Tracker, Open Dental. We keep adding more every couple of weeks, but that's where we are this far. And right now, the subscription rate is $300 a month, $50 a hygienist, but we can definitely surpass those dollar figures in terms of revenue.
Yeah, a lot of people look at those numbers and say, well, I'm going to spend, I don't know, call it $600 or $700 a month, but I'm going to gain like, $20K. That's a
month.
pretty good deal. Yeah, that's a pretty good deal. I'd take it. Yeah. Yeah.
Yeah.
Because most people don't think twice about, getting a patient reminder system or something like that. And your return is good, but is it that much? I don't know. To me, it's if you've got a right mindset about investing in your business, to me, spending $700, even whatever it is, to get 20,000 is like, how many $700 can I put in this machine? This is a good deal. So
Right.
I think it's cool. I think it's got a unique place in the market. There's nothing like it. For those in the US who will hear this, we have some clients down south, of course. It's coming to the US. Not there today, but if you're interested, you can certainly put your name on the list. Obviously, the more demand there is, the faster it gets there. But yes, as you mentioned, when we first started talking, there was only, I think, 3 platforms that were integrated. Now there's 6 or 7. And so it moves very quickly. You guys are always developing. That's just a great problem to have. So yeah, I would suggest and I would encourage, just out of curiosity, if you want to see where your practice is, reach out, get the initial assessment done, see the gap, and then decide, is it worth it for me to spend X to gain Y or not? I think that's kind of a logical thing.
And our assessment base starts in 2022. So we look at from 2022 to date. So you've got a better idea of what's been going on in your house. Very hard to work in your own chair and look at what happens in the other 3 guys beside you. You can't control, monitor, and if you do, you're looking at it at 5 p.m. I'm not doing anything with that information at 5 p.m. I'm not going to call you at home to tell you I'm not happy.
Yep. Yep. Any final points that you want to share with listeners?
Angela?
Well, we'd love to people to reach out to us and see what we can do to help them. I know myself, I'm a firm believer in numbers. I love numbers because then you can better make plans in what you want to accomplish. And the other side of it too is, we know that there's a shortage of dental hygienists. Wouldn't it be great to, hold your people in your house by appreciating them for what they do? Like if you have an amazing hygienist that is coding properly, that is doing the do but missed, is elevating your patient care, would you not want to ensure that they stay with you? And this is one way that you can do that. And on the flip side, if you have new hygienists, we all have new hygienists in clinics, being able to coach and develop them is key. And you can only do that if you have that information. So we'd love to help anybody that wants the help, reach out to us.
Just looking at the return metrics, I was talking to a client this morning and he put it very well, and I hadn't thought about it this way. But he said basically the return for getting the RNA platform installed is like, he says this, his words, not mine. I basically get half my hygienist's wage back every hour for having the platform. So to me, it's like, wow, everyone's complaining about how much hygienists are being paid these days. And I'm not saying that it's right or wrong, but the wages keep going up. We know they're not going down. That's one way to mitigate the loss right there. So it's just like and again, another thing it's interesting to think about because we obviously teach a lot about this on the business side too. If I'm adding, say, $100,000 per chair, as you said, and again, that's not a guarantee, but it's average. So if someone adds, for instance, $100,000 per chair, that is mostly bottom line. That kind of goes straight to EBITDA because it's not costing you more to generate it. No. Just the cost of the software, which is minimal, but I'm not needing more supplies, etc. I'm just actually coding properly. So that's a really quick way to ramp up the value of the practice and the profitability of the practice too as a byproduct. So awesome. Thank you both for being here. Thanks for joining me. Everyone, again, that was www.rna180.ca. And do reach out if you have questions. Thanks for being here.
Thanks for your time.
Thank you very much, Carlo.
Thank you for listening to this episode of the Canadian Dentist Podcast. If you want to know how Dr. Biasucci tripled his practice in 3 years and cut his work week in half, request your free information kit at theelitepractice.com.